They are also a professor. He is also teaching. He is also a community worker. They will be sharing some information that's very special. How you can increase your life. You can have more information from him here, Dr. Cheema.
Thank you, Prabjot, and welcome everyone. And I want to talk about a lot of things, but in next 10-15 minutes, I'll try to explain to you in simple language about diabetes. And first of all, nurse practitioner explained it to you very well, because the issue is we all think about, and we also think, it's always duty of our primary doctor and all the people who are here, and they're equally important to everyone. So I think if you think about everybody and you listen to everybody what they have to say, and then you can teach others. I want to talk to you about the diabetes, building your knowledge about diabetes. How diabetes affect more than just your sugar, and what part of your body is damaged, and so many things that you don't know earlier, and what are the reasons. I'll focus on type 2 diabetes. And what is type 2? How does it affect? And insulin doesn't work. And out of those reasons, I'll talk about those reasons. So those are most important. Most important, the machine. Pancreas is the main machine to control your sugar level. And it doesn't create insulin and doesn't get dissolved further up. And it's going to damage our body further. And you cannot function well without sugar as well. So it's very important. But it's also important not to have too much glucose or too much sugar in your body. And the main reason is increasing weight. We were all fit, and they were all working hard. And people were, when they were working hard, they were able to control your weight. And they used to say, if you're not heavy, that means you're not getting enough food. So the fat that's attached to your tummy, you should control that. It's very important to control that. And the second is stress level. Everybody thinks we belong to this community, we have the stress so much, we got it, we cannot change it. But we can change the stress level. And our stress level also goes up. That you should also check your blood sugar levels, because it affects, the stress affects, and the medicine also affects. When the doctors, we give you medicine, and when you're taking the medication, and every medication has different side effect. There are so many medications, they increase your blood sugar level. But I want to make sure that you should keep this in your mind. There's some good medication and some bad medication and how it affects. So ask your pharmacist. And people who have long-lasting asthma problem, and doctor has prescribed you some medication, and your sugar level will go up because of that. So you should monitor that as well. And I know some people won't like this. Our diet is very important, and that has ruined our life. And our body has not changed, but our diet has changed. We are using diet against our own body. We eat too much, we are eating too often, and we are eating excessively. And all our food, our sweet shops, wherever you go to, any function or program you go to, like any festivities, Diwali, any temples, gurdwaras you go to, and we are wasting our own body with our own money. It's very important. We don't really think about it, and that the cultural problem we have. We need to change that. And first, people 40, 50 years old, and the people are thinking we are gone, it's our time to go. Now people are living up to 90, 95. I'm 68 and I'm totally fit. I'm not saying I'm going to leave in 5 years, but if you control your diabetes, it's really important to control that, control your activities. It's very important.
Lifestyle is very important. How you eat, how you drink, what you eat, what you drink. Most people think the one drink is not going to make difference, but what about other things you add to it? For if anybody has any suspicion, you can see Health Canada guide. They set new guidelines before 7 to 8, but now they said no, less than that. Please bring the next slide. These are little small things, but they make a difference. I want you to understand, when you have diabetes, it's gonna damage your body from your nails up to your head. It will affect everything, and it will affect adversely, not a good effects. How you will get heart problems. When you have diabetes, you will have cholesterol problem. There will be less activity. It will stress your heart. If when you will have, it's not only heart problem. When you have heart problem, your whole body will be affected. So it will impact the whole body. For example, kidneys. It's very important about talking about kidneys. It's not a little thing. You will say, oh, it's not much, it's just little bit protein leaking in your urine. When the protein is leaking in your urine, then you should be careful. Should be a red flag. You should go to your doctor, to your primary doctor, that your kidneys are leaking protein. You should be watching. So your kidney function, for example, you should be told your kidney function is impacted. You say, okay, I'll go home, I'll talk to my family, but you should get your kidney function checked every 3 months. You should be monitoring your kidney function so that you can prevent it for the damage for a long time. You can go to any renal dialysis clinic. Your eyes will be opened, because you can see, you can focus, as I explained earlier. Wherever your blood sugar will go, it will affect your organs. It will affect every organ, every way. And it will also affect their personal life. How it happened, how did it happen? But it takes long time to happen. Diabetes also affect your vision. The eye doctor will explain about the effects, but unfortunately, it's not only the family doctor's work. It's your responsibility as well. It's not only the responsibility of the family physician. When it starts, it will affect the vision, and your eyesight could go in a long time. Please go for the next slide. So I can tell you in 10 minutes how you can start from the brain. So we will start from the brain. Stroke. Your memory is gone or affected. It all because of blood sugar. There is no second option. It's all because of your blood sugar. Check your eyesight all the time, because it will affect your eyesight as well. Kidney, it will damage permanently to your kidney. So in community, you can see people are facing problems because they couldn't handle these things properly. How about diabetic foot? So, so it is explained to you earlier very nicely that there is numbness, there is pain, my shoe was not correct. So buy good shoes for your health. It's very important. Next step is, next slide please. It's very important to keep your weight maintained. Normal body weight is very important. So we are having 2000 worth food, calories worth food, and if you walk, maybe you are spending 50 calories. Kelly, you have to control your portions. You have to control your portion. So you should be controlling your serving, less food. 50 years earlier, you are sitting here, all of them. We are coming from the same households. So eat as needed. So you go home, you, so you eat food, and you eat it 3 4 times. Sometimes same problem on the parties. You have to control your serving. Same thing in the households. So if you are offering them more food, it's very important to talk about these things when we go home, eat, to visit someone, you say hello, and then it's very important to control your weight.
It's very important to have the weight under 100 kg. 80 is best. And the body mass index, we should have. Our body shape is different, the frame is different, and it affects your body differently. It's very important to control that and to walk. And I know a lot of people don't walk. There are only few people say I get tired, I cannot go. But please at least walk 4 or 5 times a week, 120, 150 minutes. Not doing anything at home. Go outside, move your body, become active. Exercise is really important. And also have some exercise that you can do for muscle resistance. If you have problem, you cannot go to gym, walk, take somebody, ask somebody to take you there, just walk. And there's so many parks in Surrey. It's very important to walk. And it's also really important to take medication regularly. Gurvinder will explain it to you later, but it has expanded so much. Ask them questions, and they will explain it to you. And I just want to tell you the medicine. Some people they get medication prescribed, but they actually don't get the medication, and sometimes they cannot phone or they cannot order it. So it's really important to take the medication as prescribed. I have already talked about the complications. Until your hemoglobin A1C is not consistent, it should be below 7 for years. If it is not, then you'll have complications, and it will continue to create complications for you. And you need to check it every 3 months, not 6 months or a year. Stroke or heart attack, it will create all those problems. So if you don't control and prevent the complications of diabetes, it's very important, as I explained to you. First of all, hemoglobin A1C, it should be below 7, and it should be consistently below 7, and especially the blood pressure now. And you also know, and how many times you have asked your doctor what's your blood pressure, and they said fine, or you said fine, and goodbye. And ask them if it is between 120 80, and control your cholesterol, and ask them the reading, and what's the highest, what's the lowest, and where should I be, and where am I. Ask them, learn the vocabulary, ask the questions. A1C should be that much. And you should know about kidney functions, get the eyes checked. And if you don't check all those things, you are damaging your own health. And I want to talk to you about medicine. Not much, but just a little bit. But we do have pharmacists who are very capable, and they will explain it to you. There are different medications, and there was a time when metmorphin was the only one available. And then there are third, fourth, and other medications. Every medication has different mode of action, and it's your doctor's duty to inform you. And we have doctors who will explain it to you better. And it should be based on your age, based on your exercise, based on your need. You should take that medication. Fortunately in BC, there are so many different medications that Ministry of Health has approved, and they have expanded that. And we are all benefiting from it. I am diabetic myself. And how do I manage it? Which medications are covered, which are not covered? The medication that is covered, which is fine for you, doesn't matter how expensive it is. It's not more expensive than your own health, your kidneys. Even if you save $50 a month, you cannot save yourself. The check or the money you receive, it's for your medication. So try different medications if you need to. And if you need to take a medication, take it. It doesn't matter how expensive. And ask the pharmacist, how do you get it, how it's made. 400 million people in the world has diabetes in the world. And there's different sort of research being done on this. And increase your knowledge about this issue. And talk to your doctors, talk to others, pharmacists, 4 times. And see a doctor at least 4 times a year about your diabetes. And this is my weight, this is my height, and this is my hemoglobin A1C, and what side effects this medication has. And after doing all that, and when you go back 5 months, don't mess up all that. And follow up the same recommendations even if you're out of country. And don't think, it works in Canada, not in India or anywhere else. So take the medication. Make sure you take the medication. It's very important. And, the approach is very important, that how to control your diabetes and how to save yourself from diabetes and how to take care of your health and how to survive, and economically how it is better for your body and your health. And if you go to the doctor, and sometimes you don't learn that. And what are you going to do in 2 or 4 minutes? Your relatives are waiting outside. And this all impacts your health. And our purpose is to explain it to you. And we've been doing this program for the last 12 years. I'm tired of doing all these programs every 4 months or every month. We're doing this. And please take care of your health. And pay bit more attention. And this is our body, it's going to go with us. And which organ are you going to save, which organ you need, you should look after all those. And keep your health, your body healthy. And we are living in a good place, a good environment. Health services are the best. And use them effectively. And I'm talking to you, think about it. And I have done these programs many times. But please pay attention to your health. And don't rely on anybody else. You are only responsible for your health, no one else. And we can do only a few things. Thank you very much.